This is the digestive gland, liver, and pancreas histology tutorial presented by the SA Charles A.B. We reference Atlas of Histology with Function and Clinical Correlation by Dongmei. So here we continue with the digestive glands and pancreas with histologic presentation. So, as you can see, this needs to know that the general glands inside the digestive tract are the salivary glands that exist on its own. Okay, now the salivary gland, we have major salivary glands that you have to know. Now, with the major salivary glands, there are three major salivary glands. And then we have the parotid gland, we have the submandibular gland, and we have the sublingual glands. Other glands are the minor. So and then the other salivary glands are the minor salivary glands. Now for the pancreas, generally you need to know that the pancreas has two main portions. It has an endocrine portion and it has an exocrine portion. Now after knowing that, you need to know that the exocrine pancreas is the part of the pancreas that is going to secrete pancreatic juice and is going to be connected to the bile duct to produce a common bile duct, and is going to be connected to the ampulla of bladder, which is at the level of the sphincter of Oddi. Now for the liver, you need to know that the liver also consists of two main parts, endocrine and the exocrine liver. The endocrine liver is the one that is involved with the production of insulin-like growth factors, and then also the modulation of glucose in the body, while the exocrine liver is the one that is involved with the production of bile and all that. Now for the gallbladder, you need to know that this is where the bile is being stored. Now this is a general image of the accessory digestive tract structures. So we start here. This is the parotid gland, is the largest gland, it's the largest salivary gland, and then there are main ducts of the main ducts of the parotid gland. They're called the duct of Stenson's. Then you have the submandibular gland here with the main duct of the submandibular gland, and then you have the sublingual gland with the main duct here and the minor ducts here. Then the next thing that you have to see is the liver. So this is the liver, is another accessory digestive tract structure. We have the gallbladder, we have the pancreas, you have these are the content of the liver. The liver is divided into two lobes. You have the this lobe here is the left lobe, and here is the right lobe with the gallbladder here. So generally, this is the digestive tract and associated organs. We say that the major salivary glands of the parotid gland is a serous gland. Submandibular gland is a mixed gland that is serous and mucous, which is predominantly serous. And then lastly, the sublingual gland is also a mixed gland, but is predominantly mucous gland. Now we have the pancreas. The pancreas is an endocrine and it has endocrine function. Endocrine pancreas is inside the islet gland, as we are going to see later. The liver consists of the central artery, the portal triad, the liver lobule, that is a classic lobule, the portal lobules, and hepatic acinus, as we're going to see later. And then the gallbladder is made up of the mucus, the mucosa, the muscularis layer, and the serosa layer. So let's start. So generally, you need to know that the salivary gland has these three main portions. Easy, clear. And now we need to know that the salivary gland is either a mucous gland or a serous gland. Easy, clear. Now, serous gland, you need to know there's a difference between mucous gland and serous gland. The mucous gland has a grade. There are granules inside the cytoplasm of the cytoplasm of cells inside the mucous gland. While inside in serous gland, you are going to see many granules inside the cytoplasms of cells that have serous gland. While in mucous gland, you are going to see less cytoplasm. The cytoplasm is going to be more clearer. So this is schematic representation. As you can see here, you see here is going to be more pinky because of the coloration by the granules, and these are mostly serous acinus with serous cells, and these are the ducts of serous acinus. As you have seen before, this resembles a compound here. As you can see, the round bottom flask here, it shows that it's an acinus. Is it clear? And here is a tubule because it's just like the test tube shape, as you have seen on the gland histology before. So this one is a mixed gland because it has both a mucus, that's a clear cytoplasmic cells, and it also has a demyelin of pinkish cytoplasmic cell with granules. Is it clear? So these are mucous cells here which are clearer. Now this is the duct, the duct of the cells here. Now the ducts of the cells is this small duct here. So usually you need to know that small ducts are made up of simple cuboidal epithelium, but the larger the duct it is, the greater it's going to convert from simple cuboidal epithelium to stratified cuboidal epithelium to even a stratified columnar epithelium. So this is a diagram of a parotid gland. So we say that parotid gland is made up of serous cells because it's going to be a serous gland. So as you can see, you see they are going to be serous acini here. You see that the cells inside are staining. You see it is staining purple. Why? Because it contains granules inside. So here is going to be serous acini. Here are some adipose tissue inside the parotid gland. Here is going to be the connective tissue, which is usually going to be setae of connective tissue. And then we also have some striated ducts. So these places here are the ducts now of the different acinis. Now generally in the salivary gland duct system, it starts from the gland, that is acinus of the tubules, then it goes to the small intralobar ducts, then it goes to the striated ducts, then it goes to the interlobar ducts, then it goes now to the main ducts, the major ducts. Now let's visualize now the parotid gland with a higher magnification. So with the higher magnification, you can see here that there are intercalated ducts also. This is another form of ducts here. So you see intercalated ducts, these are intercalated ducts here. These are containing these are glands now containing the serous cells, while this in between the glands are the ducts, as you can see here. Now you need to know that the serous cells are columnar cells. As you visualize here, you see that the nucleus of the columnar cells are mostly located at the base, and then there are granules at the superficial aspect, at the apex of the cells. Is it clear? And then after the apex of this, you see that the apex of the cells also is this pink staining or purple staining because it contains granules which contain the proteins of the serous material. Now, clinical correlation of the parotid gland is a pleomorphic adenoma. So, pleomorphic adenoma is also called a benign mixed tumor. It's a most common tumor of the salivary gland, pleomorphic adenoma. The majority is approximately 80% and occur in the parotid gland. So, how do you visualize pleomorphic adenoma on histologic section? You're going to see microepithelial cells. And you see myxoid background. So those are the two major elements that you see on pleomorphic adenoma. Then the next thing is a parotid cyst. A parotid cyst is a fluid-filled closed cavity occurring within the parenchyma of the parotid gland and is usually caused by trauma, infection, salivary gland stone, and or even a tumor. So on the histologic section, what are you going to visualize? Visualize a cyst. You're going to see stoma and inside the parotid gland. So the next gland to visualize now is the submandibular gland. The submandibular gland, you said, it's a mixed gland. So this is a small magnification. You see that the submandibular, since the mixed gland, consists of both. Here, this demyelin is a demyelin of the serous cells making the serous gland, and here we also have mucous gland. I've already told you that the mucous gland have a clear cytoplasm, as you can see here, and the nuclei of the mucous cells are at the base, basically. While this is the demyelin consisting of the columnar cells of the serous cells of the columnar cells, which are serous cells. Is it clear? So the serous cell, as I have said, they have granules which are going to stain purple or pinkish. So they are going to stain with hematoxylin and eosin stain. And then the mucous gland, they have no stains. So the stain is going to be lesser. That's why it's having a greater and a clear center. So this is the electron microscopic view of submandibular gland. So electron microscopic view of submandibular gland here, it mostly shows serous acinar cells. So for submandibular gland, so you can visualize here, this is the lumen here, this is the nucleus of the acinous cell. So this cell is mostly going to be a serous cell, while the nucleus is large and occupies a great portion of the cytoplasm. If the nucleus was only located at the periphery, at the basal-most layer, it would have been mostly mucous cell. And also you need to know that in serous cells, the granules are staining, are opaque. Are you getting? Why in mucous cells, just like goblet cells, the granules are going to be whitish, they are not opaque, they are lucent instead. So these are the phenoplasmic order which is used in production. Now this is the example of a mucous cell. As I have said, you see that these are mucous cells which are lining the lumen. So the mucous cell, you see that the granules here are going to be more electron lucent. Are you seeing? And then the nuclei, you see that the nucleus of these cells is much more at the base. While in the case of serous cell, the nucleus all can take all through the cell surface, and then the granules are going to be more electron dense. While here the nucleus is much more at the base here, and then the granules are going to be electron lucent. It's going to be whitish or clear. Is it clear? Now the clinical correlation here is the squamous cell carcinoma of the tongue. So squamous cell carcinoma of the tongue is a malignant oral neoplasm representing the most common intraoral cancer. So the most common intraoral cancer is squamous cell carcinoma of the tongue. So how do you visualize squamous cell carcinoma of the tongue? You are going to see squamous cell carcinomas. So squamous cell carcinoma. So cells are going to have different shape, and they are going to be squamous certified squamous epithelium origin. Is it clear? Now the striated ducts. So how are the ducts in the submandibular gland? So you need to know that this is an example of the lumen with the ducts. So they are called striated ducts. Why? Because the cells that make up these ducts have striations inside. Is it clear? The cells that make up these ducts have striation inside. And now this striated duct, so these cells have striation inside, and these cells have a simple cuboidal epithelial cell where some exchange of material can still take place. I've told you that if you are simple cuboidal epithelium, you only have one cell thick. So since you are still only one cell thick, you can have some exchange of materials still with the lumen. Is it clear? So sodium can be reabsorbed, sodium can enter the cell, potassium can be released, hydrogen carbonate can be released, chloride can both be reabsorbed, or it can be released into the circulation. Is it clear? So now the next thing, so this is the interlobar duct seen on electron microscopic view. So the interlobar duct is going to be made up here of the basement membrane and here of the lumen. Is it clear? So these are the cells of the simple cuboidal epithelial cells which make up the interlobar duct. But since the interlobular duct is small, so it's going to be made up of a simple cuboidal epithelium which is going to line the duct. Now the next gland is going to be sublingual gland. So for the sublingual gland, it's going to be more mucous gland. So that's why you see mostly clear cytoplasm cell here. Is it clear? So since it's more of mucous gland, so you're going to have clear cytoplasm cells which are mucous cells. So here are mucous acini. So this, and I've already said on the chapter of glands that the acini are the structures that have a round bottom flat appearance, while the tubules are the structures that have a test tube appearance. So if you want to know generally what's the meaning of acini and tubules and the generalities of the glands, just go on the chapter of glands that we've seen initially. So this is still sublingual gland with the mucous acini with clear cytoplasm, since they are mucous cell. Now there are some serous cells. So some serous cells inside the sublingual gland. That's why there's a representation of a million of serous cells here. And serous cells, I've already said, they are going to be having granules that are going to be staining with eosinophil stain. So that's why they have a stain here. They are purplish in color. Now, clinical correlation is salivaritis. Salivaritis is just inflammation of the salivary gland, and that inflammation of the salivary gland can be due to viral, bacterial infection, autoimmune disease, or may be due to predisposition from a salivary duct stone. So on this salivaritis, what are you going to visualize in the histology section of the salivary gland? You're going to see lymphocyte, and you're going to see in the sublingual tissue. You can visualize inflammatory cells such as lymphocyte to know that there's inflammation there, and you may also see exudation. Now, the next chapter you're going to visualize now is the pancreas. So I've said that the pancreas has so many parts. There's the endocrine part and there's the exocrine part. So this part here is a representation of the exocrine pancreas. So it is mostly made up of acini. So complex compound acini, as you can see here. Are you seeing? So you have compound acini here. So these are the cells, the serous cells that make up the acini, and they are going to secrete into the intralobular ducts. Then the intralobular ducts are going to bind with each other to form the interlobar ducts that are going to form now the main duct. Generally, now the main duct now, which come from the interlobar ducts, is going to bind now with the common bile. Is going to bind to the bile duct to produce the common bile duct that is going to drain at the level of the ampulla of Vater. Is it clear? Ampulla of Vater that is going to drain now into the duodenum. So those are the points you need to know. This duct that comes from the gallbladder is called the cystic duct, and this duct that comes from the liver is going to be the common hepatic duct, and these two ducts are the right and the left duct respectively, left hepatic duct respectively. So this is the head of the pancreas, this is the body of the pancreas, the tail of the pancreas, the three main parts of the pancreas. So now let's visualize the endocrine and exocrine pancreas. So you need to know that one. So the endocrine pancreas lie within the islets of like Langerhans. So these are islets of Langerhans here, the places which are a bit clear stain, as you can see here. Why this other part which is dark stain here, which is a more pinkish stain, is more of exocrine pancreas. So I've told you that you need to know that the exocrine pancreas is mostly going to secrete enzymes, and enzymes are proteins. So that's why you see that these are going to be serous cells that are going to be lying inside the exocrine pancreas. Since there are serous cells inside the exocrine pancreas, that's why it's going to be more of a purplish color. So it's going to stain with eosine stain, is it clear? And this is the duct that is going to drain it. So as you can see, these are the centriacinar cells with the acinus here, and these are the interlobular ducts here, and these are the different pancreatic acinus, is it clear? These are now the islet of Langerhans, which are more clearer. So the clinical correlation here is the acute pancreatitis, which is an acute inflammation of the pancreas characterized by severe upper abdominal pain, nausea, vomiting, and elevated serum pancreatic enzymes, mostly lipase and also amylase. So on the histology section, what are you going to visualize? You see acute inflammation, that is by neutrophils. You are going to see neutrophils, inflammatory cells, just neutrophils inside the pancreas. You are going to see, you can have also fatty necrosis inside the pancreas, and you can also visualize pancreatic parenchyma tissue is going to reduce. So now this is the histologic section now, and the electron microscopic view of the pancreatic acina. So the electron microscopic view of pancreatic acina show a lumen here, and this is the nucleolus of the pancreatic cells. So these are the nucleus of the pancreatic cells with their different granules here. So these are the zymogen granules, and the zymogen granules are going to secrete now the different enzymes are going to pass into the exocrine ducts of the pancreas. Is it clear? So this is the nucleus of these different exocrine cells. Now for the centroacinar cells, so these are the cells here. So they are going to still have the zymogen granules that are going to secrete now into the lumen. That's going to still going to go into the interlobular ducts that is going to move out. So from there we are finished now with the pancreas. So the next thing to see now is the liver. So with the liver, you need to point out the fact that inside the liver, the arrangement of the liver, you need to know that the liver is arranged into different lobules. So on the schematic view, so this is the gross anatomy here. There is the right and the left lobe of the liver. Separating the right and left lobe, you have the falciform ligament. Underneath the right lobe, you have the gallbladder, and then you have the portal triad, with still the outer and the inferior renal cava just posterior to the liver. That's the gross anatomy. Now, the schematic representation of the microscopic anatomy of the liver shows that the liver is arranged in different lobules. So there are different lobules in the liver arranged as such here. Now we need to know that at the center of the liver of the lobules, at the center of the lobules you have the hepatic vein, and then at the terminal points of the different edges of the lobules you have the portal triad system. And the portal triad system consists, so this is the portal triad, it consists of the portal vein, it consists of the bile duct, and so also the hepatic artery, while at the center here you have the hepatic vein. Is it clear? So this is a classic lobule that you see with 6 portal triad and 1 central hepatic vein. Is it clear? So those are the different things you see. Now now we need to point out the fact that we need to point out this hexagonal diagram. So one portal triad is going to supply in this triangular manner. Is it clear? So there is one lobule, classic lobule here, and this classic lobule is going to be supplied by this is supplied by 6 portal triad, and is going to be drained by 1 central hepatic vein. Now the supply of the portal triad is going to be done by the partial lobule, and that partial lobule now consists of 3 central veins. So you have so that's the portion that particular portal triad is divided now. This triangle is going to supply now this particular triangle. Now you need to know that if you are not speaking about the classic lobule, you can still speak about the portal lobule. Now the portal lobule now is edged by 3 central. You have 3 central hepatic vein. 3 central hepatic vein are going to line it, and then there's 1 portal triad at the center. Is it clear? So it's a triangle lined by 3 central vein and 1 portal triad. So that is the schematic representation of all that. Now for the portal triad, so it consists of this. So we said hepatic artery, the portal vein, and the bile duct. So the bile duct now is going to drain. So we have the bile duct is going to drain from the bicanaliculi, as you can see here. So bile duct is going to drain the bicanaliculi, which is at the inferior layer of the sinuses. Then you have the portal vein is going to drain into the sinuses. So the portal vein drains into the sinuses, and then the hepatic artery also drains into the sinuses, and all that is going to supply the liver lobules. Now what is going to supply that? Now what is going to remove all the drainage system is going to be the central hepatic vein. So this is the particular diagram of the liver sinus. So we need to know that this is a histologic section of the liver, showing now the hexagonal shaped portal triad. So these are the portal triad system here, portal triad system, and then the central vein here. So the portal triad, as you can see, it is made up of the portal vein, it's made up of the hepatic artery, and it's also made up of the the bile duct, which is draining from the bicanaliculi. So sometimes you may also have lymphatic vessels, but it's less common in that portal triad. So now, what is the clinical correlation here? So in clinical correlation, we have alcoholic fatty liver disease, also called steatosis. So alcoholic fatty liver disease or steatosis is usually an asymptomatic and reversible liver condition associated with mild to moderate alcohol use, in which there is lipid accumulation lipid accumulation within the hepatocyte. So how do you visualize that on histologic section? You are going to have the portal. There is a portal area with neutrophils. You have neutrophils, you have malloryl bodies in the hepatocyte, and you also visualize steatosis, so lipid droplets inside the hepatocyte. So now let's see now the hepatocyte and the sinusoid. So you need to know that so you need to know that though the liver, so this section is the magnification here is times 523, while the magnification in order to visualize the lobule is only times 42. So to visualize the lobules of the liver, the different lobules of the liver, the magnification is going to be larger, it's going to be smaller magnification. That's only times 42. So you're going to visualize the lobules. Now these lobules are arranged in different sinusoids. So when you increase down the magnification to times 523, you can now visualize the sinusoids of the liver. And now in the sinusoids of the liver, you need to know that the liver cells are also hexagonal cells, just like the portal triad, but they are arranged in a parallel fashion. And in that parallel fashion, at the apical surface of the liver, you have the hepatic sinusoids, and then at the basal surface of the liver, you have the bicanaliculi. So those are the things that you have to note, and they are arranged in a parallel fashion as shown here. Now you have other cells also in which make up the liver parenchyma. You have the Kupffer cells, which are going to be macrophages in the liver that macrophage on worn out red blood cells. Is it clear? So this is the space of this. So the perisinusoidal space, known as the space of this disc. So that sinusoidal space is also known as the space of this. This space is formed by the surface of the hepatocyte and the endothelial cells, because you also need to know that there are also some endothelial cells inside the liver. So that surface, which is made up by the hepatocyte and the endothelial cell, is going to be called the space of this. So is it clear? So this is a hepatocyte here. So these are the smooth endoplasmic reticulum of the hepatocyte, the mitochondria of the hepatocyte here, the microvilla of the hepatocyte, then the nucleus of a lymphocyte. So the nucleus of the lymphocyte, and here we have the space of this. The space of this is a space which is between the endothelial cells and then a hepatocyte. Is it clear? Now the next thing is a representation of bicanaliculi, as I've said. So this is just a schematic representation of the parallel array of the liver cells. So in the parallel array of the liver cells, this here is a hepatocyte. Is it clear? So here you have hepatocyte which are arranged in a parallel fashion. So now in the hepatocytes now arranged in a parallel fashion between two hepatocytes, you have the bicanaliculi. So between two hepatocytes, you have the bicanalicus here. So this is one hepatocyte, another hepatocyte. Between both of them, you have a bicanalicus. Then the junction between the two hepatocytes also is made up of tight junction. Is it clear? Now, above the hepatocyte, you have another layer of cells. So this is another layer of cells, and this layer of cells is made up of endothelial cells. So are you seeing? And then you also have below the hepatocyte, you also have another layer of cells, which is also the endothelial cells. Now between the endothelial cell layer and the hepatocyte cell layer, we have what is called the space of disc. Is it clear? So we have the space of disc. Now the cells now which lie inside the space of disc are lymphocytes, just as you have seen here. So what lie inside that space of this are lymphocytes. So we have lymphocyte and we have ethos cells. So these are the ethos cells here. So just lymphocytes in that space of this. Now you need to know that there are also endothelial cells, so which are lying just above the layer of that first endothelial cells. and those endothelial cells now are also going to have made up of sinusoids. They have spaces between that endothelial cell. That's why the space between those endothelial cells is going to be called the sinusoidal space. Is it clear? So that is what is going to happen. So this cell here are the ethos cells or just the lymphocyte. Now the next thing to point out is the clinical correlation. Not to know that jaundice is a condition which is due to where there is a yellowish discoloration of the skin and then the mucous membrane of the body. Is it clear? So it is when there is excess accumulation of bilirubin inside the body. That's jaundice. So as you can see here, these are bicanaliculi which are going to exist between two hepatocytes, one hepatocyte here with a different junction between here. This is a tight junction here. As you can see, these are the microvilli for the release of the different byproduct inside the bicanaliculi. Now, gallbladder. The gallbladder is the main organ which is used in the storage of bile. Now, we need to point out the fact that there is a mucosa of the gallbladder, there is a muscularis layer of the gallbladder, and there is the adventitia of the gallbladder. Those are the three main parts. So the mucosa of the gallbladder is this with the different papillae. Then there is a muscularis layer of the gallbladder, and then there is adventitia layer of the gallbladder. Now, on the electron microscopic view of the gallbladder, you see this is the mucosa layer. It is made up of cells that have microvilli, and then this is the lumen here. So this is the interagitating lateral membranes. There are lateral membranes within them. So these are the columnar cells inside it. So now you need to know that what there are many short microvilli on the apical surface of the columnar cells that line the gallbladder. So this numerous microvilli indicate the function of these cells, which is to absorb water in bile. Are you understanding? So there are different columnar cells, and you see that the cells that line this area of the gallbladder are mostly the columnar cells. Is it clear? So there are columnar cells that are going to line the mucosa of the gallbladder, and these columnar cells have microvilli. So those are the points we need to point. So now on the muscularis layer, there are also, you have to know that there are longitudinal and obliquely oriented smooth muscles which are located there. So on that, and then the adventitia layer is made in for the connection to connect it with the liver. So the clinical correlation now is hepatitis C. So hepatitis C is an infectious liver disease caused by hepatitis C virus, which may result in chronic hepatitis and cirrhosis. So hepatitis C virus is spread primarily through blood-to-blood contact. So on the histology section of hepatitis C, what I'm going to visualize, you see portal area with chronic inflammation and fibrosis. You visualize necrotic hepatocyte, and you visualize periportal hepatitis. The next thing is gallstones, as you can see here. So gallstones is a condition in which the stones are formed in a gallbladder or in a bile duct. So there are two major types of gallstones. It can be cholesterol stones, or it can be pigmented stones. And this is the diagrammatic representation of gallstones in a patient that has a cholecystectomy. So we continue now with the endocrine gland.